Number 2 disability in modern world, especially for women after 50 years and older, is going to be osteoporosis. But unfortunately, a lot of you don't realize it. What are the main causes that you have osteoporosis? And you think it is just because the aging, it is just the weak bones, but truth is completely different. Most people think osteoporosis is just weak bones and they believe it only matters if you fall. And that is not the truth. Osteoporosis silently weakens your skeleton for years. And very often the first real sign is a fracture that changes your life forever. After age of 50, especially in women, bone loss accelerates and many people are told this is normal aging. It is common, but it's not normal. And calcium alone in a million years cannot get you better with your osteoporosis, because osteoporosis main cause is something different. In today's video, I'm going to explain everything that you need to know about the most important vitamin that help a lot of my patients, and I see every day for last 26 years when I make special nutritional programs for my patients with osteoporosis. The real problem why bones weaken over time. Your bones are living tissue, they constantly rebuild themselves. Old bone is broken down and new bone is formed. Osteoporosis develops when breaking happens faster than rebuilding. This imbalance is driven by chronic inflammation, hormonal changes, poor nutrient absorption, inactivity, vitamin and mineral deficiency, and here's the key point. Bone health is not just about the minerals or vitamin, it is deeply connected to the nerves, hormones and the blood flow. This is why vitamins play such a critical role. As I said it's not just so simple thinking that osteoporosis is just because you don't have, like calcium. It is much deeper problem, and if you want to correct this problem, you must take this information very seriously. I'm going to recommend you B complex and why nerves and bones are connected. Let's start with the B vitamins, especially B6 and the B12. Most people do not associate B vitamins with the bones, but this is a serious mistake. Vitamin B6 and B12 are essential for proper nerve signaling, protein metabolism, collagen formation, and regulation of homocysteine. And high homocysteine damages bone structure from the inside. It interferes with collagen cross-linking, which makes bone fragile. Low B12 levels are strongly associated with lower bone density, higher fracture risk, and the poor balance and the falls. After 50, stomach acids are decreased, absorption of B12 with vitamin drops, and deficiency become very common, even with a normal diet. This is especially important for you women after 50 years and older, because after menopause, your progesterone and estrogen level drops significantly, and you never in a million years you did not check your vitamin B levels if you have osteoporosis. If you did check or anything else with your blood measurements about osteoporosis, please let us know, comment below the video. I'm going to give you a normal recommended daily dose. This is exactly how I do it in my office. Recommended daily support is going to be vitamin B6 10 to 25 milligrams and vitamin B12 500 to 1000 micrograms. Preferable methylcobalamin or hydroxycobalamin. And B vitamins support the quality of bone, not just the density. So the first thing is going to be B complex. Second most important thing is going to be, of course, vitamin D. Living in the world that many people with osteoporosis have chronic deficiency in vitamin D, and we must correct this in the safe and natural way. Vitamin D is master regulator of calcium. Vitamin D, it's not just a vitamin, it behaves like a hormone. Without vitamin D, calcium is poorly absorbed, bones cannot mineralize properly, fracture risk increases, and vitamin D also support muscle strength, balance, and immune regulation. And this is why low vitamin D is linked not only to fractures, but also falls the cause of fractures. Worldwide, vitamin D deficiency is extremely common. And the modern living indoor has changed human biology, and this is perfectly easily to understand. The main sources of vitamin D, of course, is going to be the sun. I'm going to recommend you every day when you see the sun go outside 30-60 minutes, this is going to be perfect for you. Of course, you will not do this. That's why you need good quality 100% organic vitamin D supplements, and I'm going to recommend you in most of my patients when osteoporosis, minimum that you need every day is going to be 2,000, 3,000 international units daily, but maybe you need 5,000, even 10,000 international units daily. But what exactly is the perfect dose for you? You must take the blood test and see what is your vitamin D levels in your body. Next is going to be vitamin K, the traffic controller of calcium. Now we come to critical and often misunderstand vitamin K, especially vitamin K2, tells calcium where to go. Without vitamin K, calcium stays in the blood, deposits in the arteries, and does not reach bones efficiently. Vitamin K activates protein that bind calcium into bone matrix, prevent calcium from accumulating in the vessels, and this is why vitamin D without vitamin K is incomplete. Recommended daily support vitamin K2 is going to be 100 to 200 micrograms daily. Vitamin K does not thin the bones, it organizes mineralization. And why calcium alone fails? Many people take calcium for years and still develop osteoporosis. Why? Because calcium without vitamin D, vitamin K, and vitamin B complex will not work properly. This is one of the many mistakes that you do each day. First is going to be unbelievably poor diet that you eat each day, even after 50, but especially before 50 years, maybe in your 30s, 40s, you eat almost every day high processed garbage food, and you are surprised after 50 years and older you have osteoporosis. Second, unbelievably critical information is going to be taking each day chemical medication without any knowledge what those chemical medication exactly do to your body, especially with side effects. Now let me be very perfectly clear. Now listen to this, what modern medicine usually does. Conventional treatment of osteoporosis usually focuses on slowing bone loss, and doctors most often prescribe biphosphonates along the calcium support and in some cases hormone modifying drugs. At first glance, this approach seems logical. Bone breakdown markers may improve, bone density numbers may appear more stable. But here is the deeper problem. Those drugs do not rebuild bone quality. They mainly suppresses bone turnover, which is natural and necessary process. Bone is living tissue, it must break down old and damaged structure in order to build stronger, healthier bone. When this process is artificially blocked for the long periods, bone can become denser on the paper, but more brittle in reality, and over time it reduces natural remodeling of the bone, increased risk of atypical fractures, a loss of the bone's flexibility, and weakened bone architecture despite stable scans. And most of you really don't think, your doctors never tell you what are really side effects of those chemical drugs that you see each day. When people come to my office, usually when they have osteoporosis, we have serious conversation. What are the minimum side effects of those chemical medications that you take each day? And many patients also experience side effects including digestive irritation and stomach pain, esophageal problems, jaw bone complications, and the muscle and the joint pain. Another important issue is dependency. Once patients stop those medications, bone loss often accelerates rapidly, creating fear on a long-term reliance on the drug. And the most importantly, those treatments do not correct the underlying deficiency that causes osteoporosis in the first place. This is perfectly easy to understand. When you take any kind of chemical drugs for your osteoporosis and you never get better, this is I see every day for the last 26 years, those chemical medications do not fix your everyday habits, your lifestyle. It does not fix your chronic deficiency in the good quality way with B vitamins, vitamin D, vitamin K2, many others problems. You just take the pill and you think everything is perfect. And of course it doesn't. Please comment below the video. Did you take any kind of chemical drugs for the months and the years and you never see improvement? And of course this is those chemical medications dependency. This is all perfectly packed just for you. And if this works exactly, no one will have osteoporosis, but right now we're living in the world that it probably like 200% more times osteoporosis than 20 years ago. Now I'm going to give you a 12-month scenario. 1 chemical drugs, no nutrition and no lifestyle change based on 26 years of MarioLab clinical experience. In the first months, bone loss appears controlled. Number looks stable, but underneath bone quality continues to decline, imbalances worsens, muscle strength drops, and the fear of movement increases. Fracture risk remain high, especially in the hips and the spine. And patients feel protected but becomes more fragile with the time. And I'm going to give you another scenario, what I see in my practice, especially when I make MarioLab nutritional programs with natural remedies and healthy lifestyle in my patients. This is just my experience with patients who take good care of themselves with our direction. This is MarioLab nutritional, natural remedies and lifestyle protocols. When we apply structured MarioLab program, the strategy changed completely. We do not fight the numbers, we restore the system. From the very beginning, natural remedies are always part of the treatment protocol, and they are not optional and they are never used randomly. They are selected based on the individual condition, absorption capacity, and overall health profile. We support nerve-bone communication through balanced B complex, especially B6 and the B12, which help main coordination, control muscle, and the bone quality. We improve circulation, absorption through the proper vitamin D support, ensuring that minerals actually reach the bone tissue. And we guide correct calcium placement with vitamin K2, activating bone-building proteins and preventing calcium from depositing in the arteries and in the soft tissues. And one of the main reasons why my patients get healthy is going to be special natural remedies that are scientifically proven, and I see it every day in my practice, that help with osteoporosis. And this is one of the main reasons why people get healthy. In addition, natural bone supporting remedies and consistently included. These help reduce silent inflammation, support mineral metabolism, and improve overall bone resilience without suppressing natural remodeling. Nutrition is adjusted in a realistic and sustainable way, and protein intake is optimized to support bone matrix and the muscle growth. Digestive support is included to improve nutrient absorption, which is often compromised at the age of 50. Movement is introduced carefully and progressively, and we focus on stability, posture, and control strength rather than aggressive exercise. And 99.9% never heard about those type, never in their life, and they only think I only use 1 chemical medication each day and I am perfect. Unfortunately, my dear viewers, we see all around the world, this is not the case. And usually, if my patient follow those 12 months my natural remedy program, they experience stabilization of bone density, improved posture and walking confidence, and better balance and coordination. They reduce risk of falls, and they stronger muscles that actively protects the bone. And bones do not become young again, but they become stronger, more resilient, and safer. And this is not symptom suppression, this is realistic prevention and support guided by nutrition, natural remedies, and the healthy lifestyle principles. And just two more very important information at the end of the video. If you're watching me from any country in the world, I urge you call my office, send us a message through Viber or the WhatsApp, and I will be making sure that you get my MarioLab Special Nutritional Natural Remedies program, especially for your osteoporosis, how I do with my patients. And we really can help you. Call us. We are here to make you healthy again. Second most important information, of course, when I said about osteoporosis that you call my office, this is especially for everyone who suffers from chronic osteoporosis, maybe for the months and the years. Then call our office. But if you're not that person and you have osteoporosis in early stages, and if you want to find out what are the best supplements in the world that especially can help you, especially 100% organic minerals and vitamins that we use in our medical clinic, you can call us again and we will give you specific instructions what are we use as natural remedies and supplements, especially for the osteoporosis in those early stages that really can help you. My dear viewers, thank you for following me. God bless you. God bless your family. See you in the next video. Bye bye.